When you tie your hair up into a high ponytail and notice your facial contours naturally lifting. Many of you remember this exact feeling? Can we recreate that tautness surgically? The answer is simple: the ponytail lift. The ponytail lift is a revolutionary lifting concept pioneered by Dr. Kao in the United States. A 2-centimeter incision. Incisions are made in only 2 areas, inside the temporal hairline and behind the ear. Each is merely 2 centimeters long. They are concealed by the hair and completely hidden behind the ear. Therefore, even immediately post-operation, scarring is virtually imperceptible. However, the true core of this procedure begins here. Through these minimal incisions, an endoscope is introduced. Utilizing an HD monitor to directly visualize the deep anatomical structures, we protect the facial nerve while performing meticulous dissection. Despite the minimal incisions, the surgical intervention reaches significantly deeper planes. Merely pulling the skin does not yield lasting results. The key is the deep plane, the subsmos layer beneath the skin. It is precisely this deep structure, extending beyond the midface, past the nasolabial folds, down to the marionette lines at the corners of the mouth. The incisions are small, but the dissection is extensive, passing the zygomatic arch to the platysmal muscle near the mandibular angle. We partially release the retaining ligaments that restrict tissue mobility. At that moment, the tissues move more freely, and they can be elevated much more powerfully. Stable fixation. Now, the elevated tissues are securely anchored. The lax smos tissue is plicated with strong sutures. And for the severely ptotic anterior cheek, a specialized fixation device is utilized, the endotine ribbon. This is a bioabsorbable, ribbon-shaped fixation implant. Because it suspends the tissue broadly and evenly, the lifting effect remains stable over time. The essence of the ponytail lift is not merely pulling the skin. Minimal incisions, combined with extensive dissection and a precise understanding of facial anatomy. These 3 elements must be perfectly balanced, achieving the maximum extent of dissection through minimal incisions. This is the gold standard of the ponytail lift that I, Dr. Moon Hyung-suk, strive to deliver. I have personally attended seminars and trained at academies to deeply study the surgical framework. And as a result, here in Korea, I'm executing the definitive ponytail lift technique. The ponytail lift developed by Dr. Kao in the US. Its philosophy is being carried forward by Dr. Moon Hyung-suk.